This presentation provides us an overview of the Qsen Competency teamwork. It was composed by Maritza Vega Valdez, Ron Sen, Brenda Vasquez, Jason Tran, Ahmad Mashal, and John Mattering. According to Qsen.org, teamwork is defined as functioning effectively within nursing teams, fostering open communication, mutual respect, and shared decision-making to achieve quality patient care. By implementing teamwork, trust is established between members within a nursing team. Nurses, therefore, feel more secure in addressing errors to prevent future occurrences, as this is essential in achieving the common goal of working together to optimize the quality of patient care. So, alluding to the Josie King story, what were the issues in this case that happened as they relate to teamwork? Breakdown of communication, lack of documentation, lack of awareness and accountability by the team, including the family. Multiple nurses failed to recognize the signs and symptoms when Josie showed clear signs of severe clinical dehydration by attempting to suck on the wet washcloth when bathed by nurses. What could have been done to prevent what happened? Work as a team to provide patient-centered care and actively include the mother and family as part of a team. Assign a clinical team to the patient. Practice clear and open communication. Clinical skills that could have been implemented are assessing and implementing physical examination, including lab values, plus use of technology, that is, a recording system for all pertinent medication and health-related updates and documentation that are significantly indicative of health status, more so than signs and symptoms. And lastly, what are future recommendations to avoid the error as it related to teamwork? Constant verification with doctor's orders.
All right, so hi, we're here to do our Qsen project, and we are going to interview Gabriel, one of the RNs here at Qsen South Sacramento facility. So, hi Gabriel, how are you doing today?
Good, I'm good. How are you?
Good, thank you. Thank you for having us.
Of course, yeah, you're welcome.
Yeah, Gabriel also is one of our clinical instructors at UC Davis Betty R. Moore Nursing School. And Gabriel, would you like to just tell us, about more about you as a nurse experience?
Okay, so I graduated in 1991, my BSN. That was 28 years ago. And I'm working at Kaiser for 15 years now. I started in 2004. And currently I'm still a bedside nurse, and I enjoy it.
That's good. That's a long time.
Yeah.
I think you started when some of us were not even born.
I know. Some people were born in 1992. I graduated in 1991.
That's good. So we're going to ask you a couple questions here. Are you okay with that?
Oh, sure, yeah.
Okay. So first of all, what is the most traditional practice in your unit that is done in your clinical area, and what are some of the sacred cows in your practice area that relates to teamwork?
Of course, the traditional nursing practice is the nurse endorsement. It's been practiced a long time before we were born, and until now we're still doing that. That's a very important part of nursing because we endorse our patient to another nurse, and then another nurse, another shift, they'll endorse it again. So it's a continuous form of communication, and we can put patient in a safe manner when we endorse the patient.
Sure.
Another traditional practice is charting. Our former nurses in the past, they do the charting. Until now, we're still doing the charting. And of course, we have rounding with a physician. We're still doing rounding with a physician. It's a very important nursing practice because there's updates in there, and we know what's the plan for the patient, and we call it MDR, or morning daily rounds, especially if we work at day shift. And other nursing practice that we are still using is a proper body mechanics. This is to preserve our body, especially from being hurt. I worked as a registered nurse for 28 years, and look at me, I'm still strong and
That's good.
And healthy, no fracture.
That's
No
good.
fracture,
And
no injury.
It helps to implement teamwork to preserve your body too.
Yeah, and you can help somebody in the teamwork. If somebody helps, ask for help, you can go and help other part of the healthcare team.
Okay. So as when I said sacred cow, nobody in the team is above anybody. anything like somebody's been there for a long time and they're kind of grandfathered. They always have a set way of doing things. Nobody disrupts the team. It seems like it's a pretty flowing team.
Yeah, we have a principle at work we call the "Don't eat your young," meaning everybody's equal.
Oh, that's great.
And we function in the we, not I, because we are a team. Sure. So it's like synergy. When everybody helps somebody, the work is done faster and better.
So expanding upon the question, I guess what is meant also by sacred cows is sometimes it's those modes of nursing that people don't want to change. But from what it sounds like within your long career as a nurse, that all of those aspects of nursing, all of those sacred cows that you mentioned, have evolved as well. So it doesn't sound like people within your unit are set in their old ways, but they've evolved along with yourself. Yes.
Oh yeah. We go with technology, and when there's a update in there, we try to transform also. Before we don't use the EMR or electronic medical record, we do it handwriting charting. Now we do computerization, so we have to, of course, adjust to the updates.
I guess within your experience, that I wanted to ask, throughout your career, has ever been like an incident where you've noticed that a nurse has been stuck in their old ways and has refused to change their ways instead of evolving with new technology?
So I don't see those kind of practice at this time. In my workplace, everybody is like going to the flow, where this is the trend now, so we do this one. Of course, there's always resistance to change, and that's a constant in organization. But we weigh the benefits and the disadvantage, and it's always on the benefit side, so we go to the benefit side.
Excellent.
Okay. So I think that answers the second question is, when we identify any sacred cows, why it's still done. In your case, like John was saying, it seems like the practice from before has been continued and kind of gone along with the technology here. You guys have moved on, advanced with time, so everything's fine. What is the culture of safety in your unit where you work at?
Okay, so first of all, basic hand washing. We spread infection through our hands, and before we get into the patient's room, we foam in, and before touching everything there inside, we clean our hands. After that, we clean our hands coming out from the room, we foam out. So those are the safety measure that we follow. And of course, we have some where is that? We follow the 8 rights of medication.
Okay.
And just to make sure that we are passing medication to the right patient, right time, right dose. Those are 8 rights. Those are the culture of safety that we are practicing, and patient identification. So at least we ask the patient their name and their age, or sometimes MR number. Sometimes we do a surgery operated on a different patient, or they operate the same patient but on the different limb. So we do the timeout. Before we start the procedure, we time out, ask for another person, come and check, are doing it right, same location, same patient, everything. So those are the culture of safety that we are practicing. And of course, we have this bed alarm, child alarm. Sometimes we have patients with confusion, and they just jump out of bed and they're unstable. They fall, hit the head on the floor, have subdural hematoma in there, or bleeding. It's a very dangerous situation. So make sure that everything is placed on alarm, patient laying on bed. Even if they are aware, alert times 4, but we still put them on alarm on, and also when they get up and sit on chair, we put a chair alarm. That's one way of monitoring their movement, and it's a very helpful equipment that we are using for the culture of safety. Of course, we have a proper labeling for our IV fluids, high alert medication, heparin, tube feeding. We have to label them. Sometimes label from the top, going to the IV or PIC line, same line. Sometimes there's a interchange of line. IV fluids here, heparin here, and then when you disconnect it and then put it back and put the rate flow instead of 10 ml per hour, you thought it's NS running at 100 ml, you put 100 ml heparin, it's a very unsafe practice. So we label everything in there for safety purposes.
So it seems like the culture of safety is pretty well defined where you work at.
Oh yeah, it's we're very strict on that.
Mm-hmm. And you've worked as a nurse for so long, so you've seen all these safety practices going and evolving, which is, you've seen a lot probably too. So
Oh yeah.
are you active in the, like, as you know, with your experience, are you like a leader in terms of safety? Do you take in a leadership role?
We have DQC. It's a committee that we lead on. So if we find something new that we want to roll out on the floor, we talk about that, and then we discuss the advantages, and then when we decide that it's good for the patient, good for everybody, then we roll it out.
Okay, that's
It's
good.
a committee.
Other than the committee, what we refer to as the culture of safety.
DQC, yeah.
Yeah, so how does teamwork factor into all of that? Is it just like holding each other accountable, or how?
Yeah, so we ask the opinion of every member of the group and what is best for the patient.
Okay.
So it's like a participative form of leadership. Everybody can participate, and everybody has to decide what is the best for the patient. What is safe practice?
Okay. So I guess we go to the last one.
Yeah.
Do you want to ask? Oh, I can go. What is the one thing, if you had to change in your area of practice, or if more than one thing you would like, if you had to change, what would you change in terms of teamwork if you had to do that?
For teamwork, let everybody know their job description. They should participate and be motivated and encouraged to work with the group. And teamwork, it's a situation where we can attain our goal with ease instead of doing it our way ourselves. And we can do a lot with teamwork. Yeah, team, group. We are a team.
So, yeah, I mean, that's a great message for new nurses coming in, understanding they're going to your team, going to your peers, and speaking up to them, right?
Yeah.
Instead of you're scared, because I've known a lot of times where nurses would be scared to ask the doctor a question because they're worried that the doctor would get mad at them, right? But I guess that's not a problem in your unit, and you guys have a good flow of communication because that's your team roles are defined, right?
Yeah, it's defined, well defined, and when you know what you're doing, don't be scared because you are on the right track.
Okay.
Yeah.
Any messages for the new nurses coming in?
For the new nurses,
Yeah.
just study your nursing and make sure you know what you're doing, and you're doing right. Start right.
Okay. Well, thank you, Gabriel, for taking this interview with us.
Of course,
Me and
welcome.
John are
Yeah.
glad to come and do this interview with you.
Thank you.
All
Thank
right,
you. Thank you for coming.
Okay.
So what is the outlook of teamwork, and what are future challenges teamwork may face? Some of these are cultures and barriers, communication amongst teamworks, patient, and the patient's family, recognizing symptoms and signs that relate to the patient's health issues, providing proper education related to the patient's health, medication, and side effects, and also mitigating the lack of communication via the hospital. Some future recommendations in order to prevent nursing errors and help promote a culture of safety include improving patient interaction and outcome, defining teamwork as a spirit of collegiality, collaboration, and cooperation existing among executives, staff, and independent practitioners, and ensuring that relationships are open, safe, respectful, and flexible. Furthermore, communication amongst staff members should be a right and should also be held as a responsibility to advocate on behalf of the patient. And lastly, what will we take with us from this presentation to our clinical practice? We can include family as a part of the healthcare team. We can also establish effective communication between all interdisciplinaries of healthcare. We can keep the family informed throughout the care process. We can create checkbacks within the care team to eliminate errors or miscommunication. And lastly, we can take initiative and speak up when noticing any gaps or discrepancies within the nursing processes within our facilities.